Hello and welcome to the Animal Eye Guy. Today we're going to have a look at how to fix a perforating lesion with some xenograft material. In this case, we're going to use tutu patch, which is bovine pericardium. So this is a lesion that we're dealing with. It's an infected perforating lesion. Got this big blob of yellow infected material. Now, because it's perforating, we're going to do a two-layer procedure. So we've done the keratectomy bigger than the actual perforation. So we're dissecting all of this infected stuff off as much as we can. And this tuto patch, which is that almost looks like a white bit of cardboard that I've cut to shape just at the beginning of the video. Um, it's tough as anything. It almost feels like it's the packaging of what it should actually be, but it feels very solid when you're suturing it. Just got a lot of substance to it. So we're just going to suture this on with some 9/0 Vicryl, put some cardinal sutures there just to sort of keep it in place and push everything else back. And we're going to do this across 360 degrees around the entire affected area. And because it's not vascular, it's basically just collagen essentially, we're going to go cover this up with a layer of conjunctiva as well. So we've got those blood vessels there to help with the wound healing. You can put this on as a standalone graft, but with perforating lesions, I do like to have those blood vessels there, and it's quite close to the limbus there, so we're not going to cover up the central portion of the cornea too much, so we should be fine. So here we're undermining the conjunctiva, making sure that we're freeing up that hood graft there. And then we're going to, again, put some simple interrupters there just to keep everything in place. It's always a bit awkward having to operate behind a third eyelid because the third eyelid always gets in the way and the conjunctiva is a bit tighter. And you can see the pupil starting to dilate. So we've applied some cyclopentolate onto the eye to get that pupil to dilate. But we've also got a big blob of fibrin and hyphema in the anterior chamber there. So we're going to deal with that later. But for now, we're just focusing on suturing up the cornea. Right, now we're going to make a side port. And we're going to irrigate, aspirate all of this material out because we have to assume that it was some sort of an infection that caused the perforation. So we want to get rid of all of that material, inject it with some antibiotics, and then close it all back up again. And then we're just closing the side ports, and then we're finished. And that was it.